how data engineering is playing a pivotal and transformative role in the area of healthcare. But health
Correct.
tech,
Correct.
especially health tech, is almost 50% of it. So all the money that
Oh,
is coming on data engineering, 50% of it is spent on health tech.
there is no AI without data engineering. It's not sustainable. There are healthcare startups that are coming up and saying that, we will, aggregate a lot of your healthcare data, but via a blockchain. It's decentralized and not one person has access to it. And I think it's a big enough market to actually use blockchain as a technology.
Hello, everyone, and welcome again for our series of discussions where we are having talks on technologies. My name is Azan, and welcome to the channel of Pace Wisdom Solutions. Today, we are having an interesting topic that is about data engineering and how data engineering is playing a pivotal and transformative role in the area of healthcare. And to discuss about this topic, I have with me my friend and our consulting partner Atul from Buckle Consult. Hi, Atul.
Hi Azan. Hi Azan.
Welcome to the discussion. Call it a
Yes. Very,
podcast.
very interesting topic today.
I think in the last discussion we spoke a lot about AI, right? I mean, how
Yes.
AI can be used in healthcare and personalized healthcare and all that. But AI is something that is leveraging the data that we have, or it needs some study. Where is it learning from? Like we spoke about machine learning, we spoke about artificial intelligence. But for this artificial intelligence to work, there's some data access or information that it needs to learn from. And that is what today's topic is, which is the more rudimentary work, more
Yeah.
uh, you know,
Absolutely. AI is the shiny layer and the data
shiny
inside
layer.
is the
Yeah.
real.
But the
Yeah.
underlying work is all about data engineering, right?
Yes.
So, like we say, we've been hearing this term like data is the new oil.
Yeah.
So, like how we process oil and get the petrol or the diesel or the residues. The same way, I think there's a whole method to the madness of how do we extract insights from vast amount of data. And it's not only that you have I mean, again, data is everything. Today we have structured data, unstructured data, semi-structured data, and then making sense out of these data and all these models learning about something from this data is, it's a very vast topic. So why not we get started about like talking about how this data engineering process is important, what does it involve in general, and then we go into the healthcare space as to how people use this.
Yeah. So data engineering on its whole is basically about getting the whatever information is possible. If you're talking about in, like you said, in healthcare, right? It's similar to when a doctor or a healthcare provider would diagnose you. They would ask you questions, right? And they already have a certain amount of knowledge as to what to ask, right? But adding data engineering into the mix is just about digitizing and using that data in the future for the right reasons, like research, faster diagnosis, access to a panel of different experts quickly, and sort of a community-led opinion about certain things on healthcare, where it's not just because it's, of course, again, one of the most sensitive industries we have around. And I think in this case, more opinions, more minds always do matter. You hear about people going for second opinions, third opinions to multiple different doctors, right? And can you imagine without the access to data, they would not. I mean, doctors also would be asking the same questions again. Researchers would have to go on very, very lengthy studies, surveys, take huge grants for actually, getting access to this data. But data engineering can help all of these members in and around the healthcare space to actually harness the real power of what we can do with the data. So basically, the value add on top of the data, like predictive analytics, that's one. Then prescriptive analytics, which is, of course, in the healthcare space, very important. And then things like study of healthcare data to improve things like drug production, drug discovery on the pharma side as well. So I think the potential is immense. It is happening a lot around the world as we speak, and with progress in storage and processing technology today, it can happen a lot cheaper and in a lot more parts of the world.
Got it. Now, let's say, where does it all start? So, somewhere when you say you want to collect data, you want to process this data, and then the AI comes in. But let's say, where does this start? Where does the content come for, or where does this data come from? So is it like a patient comes to the hospital today, everything is digitized, right? I mean, right from their registration, even the booking of the doctor, right? Today they have a lot of softwares
Yeah.
that talk about booking and the doctor's schedule management and all that. Even your prescriptions are now digitized for them to see the whole
Yeah.
case history. You don't have to carry all your historical medical records. We have this EMRs, electronic medical records today, that are stored, and lab results and vitals. Everything today, when we enter as a patient to a hospital, till discharge and post discharge, even the insurance that is covered, usually because this is a health tech and insure tech, very much health insurance is something which is the reason for also digitizing, is also because you would want to produce and give these documents to the insurance so that you can claim and things like that. Most of the healthcare prices have gone really high up. It's very difficult for individuals to pay by themselves. They need to have an insurance, right? And how do you make them accountable? How do you reduce frauds in these areas where, when so much things are there, and then everything is compliance driven, everything is heavily compliance driven. So let's, I'll put this question to you: where do we start collecting this data, and how, behind the scenes, this data is getting collected for each of these problem states?
So I think, like you mentioned, if you look at all of these data sources, one of the data sources is your patient data, right? Your patient data would be all of the data that the hospital knows about, right? Then other than that is all of your medical records and all of your vitals that you go for medical testing, right? So that your medical test provider would know. And another sleeper data insight that we have today with the increase in things like wearables, right, is your lifestyle data, right?
Yeah.
So all of these data together, I think it can paint a good picture about the medical status of an individual, right? I would say that, because each of these are taken, the data is recorded at a different point of time, and using traditional methods where you go to the hospital and they check your blood pressure and they check your a couple of metrics, right, in whatever 5 minutes or 10 minutes the doctor has, because today we don't have enough doctors also, so we can't, if we put all of the burden on the doctors today to create the data, that's not going to improve the situation at all, right? So that's why these multiple data sources come together. And of course, with the huge improvement over the last 10 12 years on cloud storage and computing, we can store the data in cold stores and all of these spaces for easy access, right? So with all of these data sources plus access to data warehousing and proper compute, I think we do have a good system that's building up on the healthcare side. Like you mentioned, where should we start? There are different owners for all of these, right? Of course, it's going to be a big task for all of them, I mean, to come together and create some sort of a unique ID. I think that would really help on the data engineering side, with where government, healthcare, individuals, and healthcare tech providers, I would say. I mean, they're already doing it in different countries where they have like one sort of schema or one sort of template of how you store healthcare data. And what this really would bring about is good data governance on the healthcare side. So data governance, of course, it's very sensitive data, right? Good data governance would help us improve the quality of the data and help us, any downstream processing of the data will, of course, add much more value than if you don't, have good data governance. So data governance, along with, these multiple sources being stored in new age storage and warehousing technology, would really be the real start.
Last time we did a intro, we spoke about the AI industry being, so big market. So similarly, just checking
Yeah.
what is the market size for data engineering, or we call it as big data, right? The volume,
Yeah.
veracity, and I think there are three V's to the big data: the volume, veracity,
Volume,
variety,
veracity,
variety,
variety. Yeah, variety. Yes, yes,
so
yes. Three V's.
when we have market size, or like the US $1 billion, if you're looking at it, it's about roughly $80 billion, and it is growing at a 15% CAGR year on year.
Yeah, I mean,
And it's saying that like it's gonna reach up to 160 billion. That's almost doubling, right? I mean, double by
I
2029.
think today, I mean, of course, maybe these numbers on the AI side may
This
be
is
a
just
little
the data
different and maybe
engineering part.
more.
I mean, what?
Yeah,
But health
correct,
tech,
correct.
especially health tech, is almost 50% of it. So all the money that is
Oh,
coming on data engineering, 50% of it is spent on health tech.
I think, because the underlying data is the juice for all of these newer technologies to work on. It has to grow at the same speed or maybe even faster,
Right.
right? Or else you will start to plateau at some stage if you don't have the right, volume, veracity, or variety of data, right? After a while, models will not be performing as well, right? And you will not be able to gain the right insights from the data available, because either you don't have enough of it or the right amount of it, or the right type of it, right? So this has to grow. I mean, there is no AI without data engineering, right? It's not sustainable.
I think it was so I was just checking what was it, variety. So it is velocity,
Velocity, yeah.
variety, and volume. Three V's. Yeah.
Volume, yeah.
So
Yeah.
it's like it's huge data, and it is coming in
Yeah.
heavy streams, live
Speed.
streaming, and I mean it's many
Speed,
things
yeah.
like that. And then it's not only just textual data, right? I mean
Yeah.
there's data
Yes.
in various forms today, right? Now sticking to the healthcare part, there's a huge like we said, the data sources are coming from all these places or different touch points where the patient is coming in the hospital. So some data, we know that it is very structured data, right? I mean, the patient information, for example, it's a very structured information. We know that okay, this is the patient, this is the age, this is the profile, this is the issue, and then there's a little this is more of structured and textual data, and then there's also a
Yeah.
little unstructured data, which is something like discharge summaries. Like a person is discharged, then there's
Yeah.
a huge information written about what was the issue, what was the finding that they had, and what is the next follow up, what are the medicines that they're prescribing to, and all that, which is a bit of unstructured data, like a huge 2-page essay where they have to report
Yeah,
everything.
yeah. More than unstructured, I would say it's ununderstandable for the
Ununderstandable
common.
also.
But yeah, because
And then you have
it's
prescriptions
highly.
data, which is again,
Yeah,
sometimes it's
yeah.
handwritten, then that's digitized.
Yes,
Um,
yes.
and then you have now the MRIs, the X-rays. These are all getting digitized, right? I mean, you don't have to necessarily wait for the film copies or the MRIs to put up in a CD and then given. All the things now are available on cloud. You go to a big hospital today, you just go to this place where you do the test, and then it is directly sent on the doctor's mobile, right? And he can be wherever, and he can just comment and say, okay, this result is out and this is the issue, right? I mean, so when these things are getting digitized, how do we make sense of this data now? Like, this is coming from various sources as well, right? The lab report is coming in a different format. There is the data coming from MRI and X-ray in imaging format. Now this may be used for further studies or these things like that. And then you have the textual data of the profile of the patient and things like that. So how do we make understanding of data coming from different sources?
I think the understanding. Okay, once we manage to sort of bring all of the data together into one place, right? Then it's like, I would say it's like a medical fingerprint of the individual, right? So over a period of time, fluctuations in all of your metrics of your body and all of that, I think that would go on to be the baseline data for models, machine learning models that are built on top of it, right? So this data, to really make sense of it, in our medical ecosystem, researchers, I mean, need to really get access to it, right? Because today, uh, countries like India and China and these bigger countries, the amount of visits per country would be a lot more, right? And there's a vast amount of healthcare data available, and giving access to, of course, in the right way with anonymization and all that, to university or research facilities, right? Where they could use this data with newer computing technologies to bring out prescriptive predictive models, right? So basically, because the onus of what data to pick and how this data will impact the health of the person, I mean, cannot be on the person itself, right? Like, we don't know what we should change to feel better or heal better, right? So I mean, of course, these access to all of this data on the education and research side would basically help. In fact, that would also fill in gaps where they say that based on their studies of the human body, these are the data points that are not available, right? It's more important for the industry to find out things about what's not available as well, because I mean, maybe that's a feature or data point that's very important to diagnose or prescribe a particular change in lifestyle or something, right? So I mean, I think um, fixing a lot of problems traditionally, like, of course, over the last 100 years, through various different data engineering, traditional data engineering, I would call it, would be like, all of these. 100 years ago, you probably had sheets with people
Writing papers.
writing all kinds of numbers and on the paper, and then you collect it across the hospital, and all of these documents are sent to the university. They hire you know uh, uh, like
Analysts and
entry
yeah,
level first year students to
do
basically
research on
probably
this.
uh, to do research. No, I mean, no, to standardize the data, and
Ah,
then everyone else probably
correct.
does their analysis on it, right? So but today we don't have that problem, right? And there, back then, it was localized, like a hospital in the US could not get data from a hospital in, like, Myanmar, Philippines, like on the other side of the world, right? But today, data is virtual, so it can reside anywhere and be accessed by anyone if given the right access credentials, right? So this way, I think we could really improve the output we get out of the data by giving access to researchers. And I think the NHS is already been doing it for the last 20 years. I mean, of course, back then also would have been very different, but
NHS of
now
the Singapore,
UK.
UK. Okay. Now, one other thing which is to look at is the process of data engineering, right? I mean, there is different types. One is the ETL and the ELT, where you extract, transform, load, and there's a concept called data lake or data warehouse lake. And there are multiple tools that are like, one is something like Databricks. We have
Yeah.
Snowflakes, and then we have many other like Azure Synapse. The Microsoft comes with Microsoft Fabric now, which has all these small pieces coming into picture based on the scale and the demand. People use stuff. And in a couple of years back, when we were talking big data, we were talking about Hadoop, right? So,
Yeah.
so how does one choose what? Let's say, for example, if they want to analyze this data or they want to have this project, how can they choose as to what should be our tools and what is the process of getting this data into a standardized format, right? So you could, some of the things, like, people still do something like Excel and then do that data prep stage, wrangling stage,
Yeah.
data quality checks, and then you put them into a data warehouse, and then you build your data marts and data cubes on top of it and things like that. Can you just uh, give a quick summary or a brief as to how these tools will be are usually categorized, or where they fit in?
I think selecting these tools, I mean, there are a bunch of factors that are important. One is, of course, data residency, right? So, data residency is also important in today's context. It's not just the banking sector that's vying for data residency. I think the healthcare sector also wants it to be quite important because, I mean, end of the day, data has to reside in the country because it's of people from the country, right? And they choose who has access, how much access, all of that. So depending on that, a bunch of solutions may automatically be off the books because of presence of data centers or uh, number of data centers, right?
Sometimes, like
Today,
offerings of Databricks or maybe even
yeah.
Snowflake,
Hmm.
you can install it in your I mean, based on the
Yes,
availability of the
on
region,
yeah,
you can install it in the servers and in
yeah,
the cloud
on
as well.
Yeah, on-premises deployments also do occur, but I think again there's a huge cost factor there, right? Unless there is some sort of a government healthcare data center where it could be like they would manage the infrastructure there. I mean that would be very beneficial on many levels. I mean not only about data residency, but keeping multiple copies, availability, and all of that, right, would also be quite helpful there. But I think one of the main um things that people in the healthcare ecosystem need to really check before selecting their tool is, of course, compatibility with a lot of other existing tools. I mean, they probably are on a different set of cloud providers or different. I mean, they're the people working in the analytics department there. Of course, they'll be used to a different set of tools, right? So all of that is also important. And yeah, end of the day, I mean, unfortunately, cost also is is important, right? So
Like
these three things,
licensing
if
and
hel-
what volume of
yeah,
data you are looking at to
yeah,
and all that.
yeah, I think it really changes. I think the volume and like all these three V's, right, that we mentioned, right? Volume, veracity, and variety, right?
Velocity and
So
variety.
velocity, veracity, and
Yeah.
volume, right? So these three things, depending on how much of each of these three points it is, it would change what tool you would go for, right?
Um,
Yeah.
so moving to something which, so this can be like, it can be a strategic idea as to use these three V's, look at what your team requires, look at the budget, and then decide how much volume is there, what is the kind of variety of data that you're getting, whether these features are available in that tool to read this kind of data and make sense easily for your analytics team, and how much of a training is required, let's say if it is upskilling or learning something new completely, and how much of a support and availability of support for this kind of work in the market is available. Look all these factors and then decide what kind of tool may
Yeah.
be required. One is
Yeah. I
you also
think
have open source options as well
yes.
today with Apache, Spark, and Hadoop and other
Yeah.
things which you can leverage as
I think along with just, I mean, to be honest, the tools, I mean, the amount of competition in the space is very, very
well.
high. So the tools will always try to, be on top of each other, right? So I mean, getting access to the tools is one thing, but more important than that is to sort of evolve the mindset of people working in the space, because you can get all the best tools and try to create the best pipelines, but people have to use a data driven approach where I mean it cannot be completely subjective as to what. So I mean subjective analysis is what happens when you don't have access to enough data, right? When you have when people use, for example, if you're going to a hospital and there is a assistant there for the doctor, I mean a virtual assistant, I mean, or a virtual or system which can analyze, okay, this blood pressure is this high, and this is basically the national average, or this is
And
like
anomalies.
what's happening around. Yeah, it can help you find anomalies and make better decisions, right? Like it should be like you have to want to use that data in the right way. So that's also a very important uh, change that we are seeing today with a lot more access and people seeing the benefits over time. I mean, just because it's there in front of you, you won't notice the benefit today. When people start using it and word spreads, of course, more and more people will be open to using it. So that's also, yeah.
So one other aspect of this is also about data security and privacy, right? I mean, we also discussed this briefly in our last podcast discussion of how privacy is very important in healthcare, and personally identifiable information should not be out and things like that. So how do we, what are some of the compliances that are there to put a check and balance on these, right? And how many are there, like for example, US being one of the largest biggest markets which is very highly sensitive on this, and maybe other markets like UK and Singapore, and now India also is talking about multiple different policies. on data security. It is as important today as banking sector, right? Today, when we talk about healthcare and information about a personal individual's health records, these are very sensitive information. So how do we put some checks and balances in terms of privacy and security?
So I think one of the biggest shifts that's happening today is incorporating blockchain in across healthcare providers. So I think in the US and parts of Asia, there are healthcare startups that are coming up and saying that we will aggregate a lot of your healthcare data, but via a blockchain, so that of course it's decentralized and not one person has access to it. And I think it's a big enough market to actually use healthcare use blockchain as a technology. I mean, of course, there has to be a market size for blockchain to be viable. So I think moving forward, a lot more of our healthcare providers are going to be adopting blockchain, and that way, I think the security aspect would be would should be handled quite well there. Yeah. So blockchain is one of the biggest changes that's coming. That's already there in some countries, but I think it's not a regulation that it has to be a distributed ledger. But because end of the day, you could there it becomes more important because there are multiple sources also, right, of data, right? If one person is like for example, the hospitals, of course, they have the budget, they will be super secure, all of that. But if it's a medical testing center, not a big chain with something more local, something in a smaller city, right? I mean, they have the expertise to do the medical tests, right? But they may not have they may not have the size to actually invest in something like data security and maybe go through a proper VAPT of their systems, or have access to distributed systems across multiple data centers, right? So all of that may not be there, right? But if they subscribe to some sort of a blockchain system, right, that's not managed by anyone, but it's just distributed, so that way they don't have to worry about security. Nobody has to worry about security, essentially, right? So it would help the bigger players and the smaller players, and it would like democratize access to the right data. I feel,
think
yeah.
the government and the policymakers are key here, because they can push a lot.
Yes.
And in India, I think we have like the Aadhaar as the Aadhaar number, which is the social security number in India. And we now it's coming something like Aabha number, which is very similar
Yes.
for the health purpose, right? So now we are coming like from the I think it's called Ayushman Bharat Digital Mission, ABDM, and you get a number, Ayushman
Yes.
Bharat number, or whatever Aadhaar based number that you have. Okay, let me just correct myself. It is for electronic medical records in India. So we have something like
Yes, for
Aadhaar
sharing
number,
of
and then sharing with the
sharing
consent.
of medical
Yeah,
data.
you can
Correct.
tell how long you want to give this data to. So you own your data. Then
Yeah.
you can decide when to give this data to someone for whatever reasons, and how long you want to give the
Yeah,
data, right?
yeah. So this incorporates the point of consent also,
Yes, that is what.
right? So
The
there's
national
always
health stack,
consent, and
that like how India
yeah,
stack is there for all these stuff.
correct.
This is something that is coming, and it's a great vision, and that's a great initiative by the government. Because now, if you then everything should be like Aabha certified, or or Ayushman,
Correct,
the
correct.
national health integration, everyone, and then you don't have, for example, a lot of time what happens is, if you have gone to I'm speaking from an India perspective. If you're going to a big chain of hospital, and then you have gone to a certain doctor, and all the tests are done there, once everything is done, now all the data, they may give you a copy, but it remains with the hospital. They may give you a copy, but
Yeah,
they have data, they own
yeah,
this data, and now we know that this data is a new oil, and they can use this for many other things, maybe
yeah,
for good, like to optimize their own operations and all that. But it could be also sold in the market, where they can get good price,
correct,
right, about this patient
correct,
health
correct,
data.
correct. Yes, definitely.
But the challenge for the patient is that this same patient now wants to take a second opinion, goes to another hospital, they may have these copies, but they will ensure that all the tests have to be repeated, or things
Done
like
again,
that.
yes. Yeah,
Because
so
going
I
with
mean, there's a
fear,
lot
right?
of
I mean, even if something like a
yes,
legal thing happens, they would say, you know what, when we did the test, this was the thing. There's no standard way of putting it. They can always tell this is a machine error or things like that. So how do we? So if we can have it in a single place, and then we said, okay, we did this, there should be some fear that, okay, it is not owned by us, but it is owned by
correct.
an individual.
Plus, I mean, think of the amount of extra time and effort and cost
Cost,
also
yeah,
spent, right? Doing the test again, waiting, right? Some of these things, like the earlier you detect it, it makes a lot of difference. Especially like recently, cancer research has become a lot better, right? There are a lot lesser people dying of cancer, percentage wise at
yeah.
least, today than 20 years ago or 30 years ago, right? But I mean, imagine if you're someone who's going to get a checkup for a certain type of disease or terminal illness, right? And you're not getting the right sort of care at one hospital, then you go to the second, and then you go to the third, and there are many people who do this, right? And at every single institution, it's like the same process all over again, right? And you're already in some sort of a fear and anxiety, like you don't know what's happening. Every extra visit you take, that just doubles the fear and anxiety, right? So on a wellness side also, this would this would help patients be a lot more relieved, where everything is seamless, and getting a second opinion is a lot easier than it's not a very high effort thing. And in fact, if tests are done, what can also be done is, if you need a second opinion, you may not even have to go to the hospital, right? If there are tests done already, and
You can just share a
you
copy
could
of your
you
these tests to some doctor
yeah,
sitting in US,
exactly,
and or maybe any part of
across
the
the world,
country,
right?
right? I mean, and then
Yeah. So in those kind of cases, right, where it's like there are even doctors, they themselves ask other
yeah,
doctors for second
yeah,
opinions,
they
right?
can be like, I'm unsure. What do you think about this? There can be a committee that can
Yeah.
decide on this,
Yeah.
and then take a
Correct.
call.
Yeah. And the whole concept of pathologists who have to analyze blood work, analyze you know medical imaging information, put all of that together and advise the doctor again, that could be done remote, right? So it could be, so places where the density of hospitals are lesser, right? Instead of, okay, we don't have a pathologist in today, they will come tomorrow and stuff like that, right? You could use some other time zone, some other anything, right? If it's if it's really urgent, right? So it gives more opinions on the same data, I feel. And of course, in the healthcare space, the more opinions do matter, and would give a better, much more accurate diagnosis. And you know what? So another point about this is that if there's no one particular owner, or if the whole pipeline of managing this healthcare data is sort of ironed out properly, a lot of non medical institutions, for example, your smartphone providers and all of them, based on your consent, of course, could give you important lifestyle suggestions, right? Based on what, because I think there is a certain part of you that the hospital knows, right? And the certain part of you that whoever takes a medical test knows. But there is a certain part of you that your smartphone or your laptop or some other device may know, right? About you, like screen time and amount of steps walked, or you know
Any
uh,
other vitals that it is
the
capturing
yeah,
suitably.
all of these vitals, right? So this, anything you take at the hospital is just, it's like a 2D at that point of time type of information. But third party devices could monitor this all the time, and it could, based with your consent, of course, it could suggest a lot more beneficial things, like, okay, you haven't walked today, like today the watches, they say, like, we've been recording for about what, like half an hour, 45 minutes, it's probably going to tell me soon to stand up, like, you haven't stood up for a while, you should stand up, right? That's very basic today, because that's very easy to suggest. But with access to a lot more information, like,
Personalized health, right?
maybe
Personalized.
yeah, exactly, yeah,
I was hearing this one of these
yeah,
podcasts where they were telling about how AI, people will rely more on AI to become mentors, right? I mean, everyone is looking for a mentor just to get some guidance on what is happening, right? And if AI has access to all these
Yeah.
data and insights, and when your
Yeah.
reliance on AI is going to improve over a period of time, and you can see that in the last 6 months how the chat GPT has grown from where it was to where it is now.
Yes.
Imagine in 2 3 years the level at which these AI systems will be interacting with humans. We would be in a situation where we will be mentored by these AIs. I mean, people would, okay, you need a you can have an AI personal trainer or a AI personal
Hmm.
guide for you for your healthcare. It may be a mindfulness, it may be for yoga, it may be for analyzing all this data and then suggesting what kind of food or
Yes.
diet you need to have.
In in fact, it would really help in the workplace also, right? A lot of time on the HR side. Like today, HRs are a lot more, open about wellness and work life balance and all that, right? So they always do send out, certain reminders like, wait, have you had enough rest today? Did you manage to? Are
Correct.
you stressed out? What kind of anxiety do you have, right? But I mean, suggesting apps or suggesting the right technology that could manage this is also important, right? Like today, we don't know what is the best way to, take a break or in between long meetings or long hours of screen time. How are you supposed to? I mean, everyone has a different idea of what we should do, right? Someone will say go outside, look at the tree. Someone will say do desk exercises, stand up and do
What's
push-ups,
best for
right?
you is something that you know and your
Yeah,
body knows, and if there's
exactly.
an AI to track this and
Yeah,
suggest you.
yeah. And I feel that, if we say AI is like a supercar, right? And supercars are getting faster and faster and faster and faster, your data engineering and your infrastructure would be like your road, right? If you don't have the right road, there's no point. Like you can build the fastest car, right? And these roads have to be good everywhere also, right? So that you can go to the right places with the same car. So I think that's the simplest way to put it out for people watching this.
What
But
are
yeah,
some of the challenges, like, even organizations which are, most of the organizations today are data driven, right? They want to understand, but I think some of the places, still the knowledge retention is not happening, and it is like, you are acquiring more and more data as well, and you want to know what is this data now correlated with this, and then enough research is happening now. So, what are some of the challenges where, or that you should think that organizations should talk about in
I
this area?
think I think one okay. So there are a couple of challenges. I'm gonna start off with some that we already discussed. One is on the governmental level, setting standards and all of that. I'm not going to go too much into it because we know that that people are working on it and it will come one day, right? The next, on an organization level, what organizations can do is analyze the right use cases and figure out whether there are gaps in our data engineering practices, or is there a way to basically improve data engineering to solve for this use case. So today, I mean, now we've talked a lot over the last some this whole recording and podcast about where all we can get data from and what technology can do with the data today, right? But end of the day, when it comes to a screen or a device, to a healthcare professional or a normal layman, they need to be able to understand it in the simplest way possible, right? So I think organizations investing in this, where the right people get the right information through these systems and devices, is the most the important thing, right? Because if we either I mean because if they don't do it, to be honest, someone will come and disrupt the whole industry. And today, and next time you go, you will see robots all over the
Yeah.
hospital, robots taking you to your room and all of that, right? I mean, that's maybe a little far away, but giving access to the right time. Like one thing I was thinking about was, so today everyone waits at the hospital, right? Has it I don't think there are very few places where you go and the doctor is just waiting for you. Hi, oh, I've been waiting for you.
Never
It
happens.
never happens, right? But so I mean, that waiting period is
Very
such a
unpredicted.
I mean, there
Yeah,
could be a lot of processing that
too
could
much
happen, right?
uncertainty, right? I mean, maybe you are on time, the doctor has come, but there's an emergency case, he has to leave. There's a lot of uncertainty, unpredictableness, and then chaos.
Yeah. So, sorry, Azan, it got cut. I
Oh,
didn't
okay,
couldn't
okay.
hear.
So there's a lot
Yeah.
of
Yeah.
unpredictability, uncertainty, and chaos because you may come on time, the doctor may not come on time, and there's
Yes.
a emergency and the doctor has to leave, right? So there can be many things like
Yeah.
these which is unpredicted and uncertain.
Yes. Yeah. So, I mean, this could, give the doctor access to a lot more of your information at the right time, right? And, there could be a system where, so, the whole patient journey that we see from, setting up an appointment all the way to discharge, right? There are so many different people that come in contact with the doctor, right? Sometimes there are different specialities of doctors that come in, right? There are people working behind the scene, pathologists, nurses, right? And then there's people in nutrition, like different patients need to have different type of food, right? So all of this data is now still a lot of it is passed, I mean, by word of mouth, right? So they have like these set meals or set processes that have to happen for a patient going through a certain illness or a disease, right? But I mean, if this could be simplified in a way where they don't have to tell each other, right? They people could be on leave, maybe the information is lost, all of that, of course, generally things that happen, right? But using the data at the right time in the right place, showing it to the right person, could make this a lot smoother, lesser chance of error, almost no chance of error, right? Unless there's some bad data. So all of these use cases will is what organizations should be investing in, like, because they know the process the best, right? So fitting the availability of this analytics or this data or information or insight to the right person in the right time. So they should I really think that investing in access to the information or type of information also is something that
At
they
least
should
in
be
these
doing.
cases, I feel markets like US, they have some organizations and structures in place like HL7, Fire, and these places
Yeah.
where you have tools and there are these tools supporting. When they're making a decision to get a tool, let's
Correct.
say a hospital or a clinic is saying that I want to manage my booking system or my patient information or lab results. These needs to be having fire compliance or HL7 compliance so that if tomorrow I want to
Mm.
integrate it with another system, because you may have a system which works beautifully for this, but for something else you may have some other system, and then that's how the beauty of
Yeah.
interoperability is required. But all these systems need to
Interoperable.
talk to each
Yes.
other. At least there it is there. In India, it is very difficult. Either you need to be such a big player that you offer everything under the sun for this hospital, right? You are also giving a software for interacting with multiple third party insurance companies, processing and all that, and then there's accounting, then there's hospital information, then there is document management, then there is clinical information, then there's pharmacy information. I don't think one company can solve all these problems at once, and then you have different software pieces
Yes.
solving these problems, but they're not interoperable, and then they don't talk to each other, and then you don't have your full data unlocked, right? Everything is separate. And that is where data engineering comes in, and if there is a possibility, you understand, connect to these data sources, do a source to target market. So all these analysts say, I want the data to see in certain way, so get this data
Yes.
source, massage it, clean it, pick what you want to see, and then put it over there. Prepare that pipeline so that whenever new data comes in and you see, the analyst sees this and then, or maybe builds a model out of it or passes to the AI, machine learning, and then you
Yeah.
have the whole process. So that's what
Yeah.
the data engineers do, right? I mean, all the hard work to get these
Yeah.
machines and things, all the topics that we spoke about, connect them, collect the data, uh, transform it, and load it to the information from where the AI picks up.
Correct. Correct. Yeah. And this would save so much time and improve accuracy across the industry, right? So, I mean, I think it's definitely something that's more and more becoming something that organizations in healthcare have to do, not want to do anymore.
Now, let's imagine healthcare in 2050 or like 20 years from now. and you have advanced AI, you have machines that are talking to each other, maybe IoTs, maybe uh, processing, and the data pipeline that is taking too much time right now. That's also one of the challenges, right? You have connect multiple systems, analyze, and then it takes a while to get this data to somewhere. How do we get real time data, information, AI? Let's talk about a scenario which is 2050, and we started this podcast talking about a patient coming in, an experience of a hospital, right from registration, admission to discharge, and then the post discharge care. How it could be, now this is a generative
Yeah, it
AI
could
question.
be.
Imagine 20 years or 25 years from now,
It.
and then what would be an best AI driven hospital?
Uh, I mean, maybe I'll get cancelled for saying this, but there may not even be the concept of a
Wow.
hospital, right? Because everything happens
Remotely.
remotely, and it's basically you get the best of care in different places. So your diagnosis may even happen before you leave the house, right? All of your smart home systems, your wearables, your uh, your medical tests, and all of these this data automatically gives access to your doctors, or I don't know, robots by then at this rate, right? Virtual doctors who can basically do like not like a pre-diagnosis before even
Before, yeah,
figuring out what the
predictive
real issue
analytics of.
is, right? Which, yeah, predictive, and yeah, and before even you think of actually sending this information to an organization or a doctor or someone, right? There would already be enough technology and apps around you. You have access to the right amount of information to handle
But
it on
this
your
will
own,
not
right?
eliminate doctors, I believe,
I
right? You would still need
No, no, it will. I
people
mean,
who,
yeah, end of the day, I mean, if you surgery and so many things are there, right? I mean, doctors are not just diagnosing, companies
yes.
are treating also. Diagnosing is just one part, right? Which is the starting part. But the diagnosing part, I think, with the access to all of this kind of technology, it will become as remote, as quick, as efficient as possible. Because I think we already have less doctors, and it's not like there's going to be a lot, that percentage of people to doctors is not going to change, right? Because it's a very hard subject to master. And yeah, so I think the diagnosis phase, the starting phase, the first phase, is going to be very deeply impacted by improvements in data engineering and technology, AI on a whole, right? Then on the surgery part, of course, there's going to be a lot of virtualization where there are remote surgeries and remote nurses attending to you. Recently, I think Nvidia launched. There was some sort of teaser that they showed where post like before you reach your hospital, or there's a
Hmm.
virtual nurse
Okay.
that guides you at home, in the hospital, in your
Right.
room, everywhere, right? And it's basically an AI avatar, exactly
Right.
like a nurse, right? And it's tuned into all of your requirements, which what you need to eat, when, what medicine, everything,
Great.
right?
Great.
So I think that's gonna happen. That's good. Not even 2050. That may be happening in a
And
couple
that
of years from
reassurance
now,
that
right?
somebody is along with you fighting the journey of that health problem, right? Along with you and guiding you, that the nurse, virtual nurse that you talk about is a really fantastic idea, because I've seen in my personal cases where I've taken people to hospitalization in close knit families, and there's always waiting for information to happen, right? I mean, when you're
Yeah,
that anticipation of what the report going to be, of somebody coming back
yeah,
and reassuring you, saying that, hey, come down, nothing's going to happen, this is a general process, and things like that. And education, an educating way, and reassuring that
yeah,
uh, we are here to take care, right? So that part, that
yeah.
empathy is something that can come in.
And yeah, true. And even the stickiness of this information, right? Like us humans, we are very serious when something happens at that point. But 6 months down the line, you sort of forget the advice that a doctor or a healthcare professional has told you, right? But if you digitize this and it is set into your lifestyle, it's easier to remember that maybe there are things that I need to change or work on, all of that, right? So with the kind of data engineering and AI advancements that are happening, this can actually happen at that scale. So everybody could have data processed just for them, reminders just for them, all of that,
That's
right?
where the
So
value comes
it
in, right?
could
I mean, because you
yeah,
want to grow the industry, you cannot just offer things. You just have to create that experience. Why would, because when
yeah,
a lot of hospitals are competing in their services and what they're offering, and that point of time, maybe it is all about how you want to give the experience. And for that, when we again speak about a person going to the hospital, there is the admission, and how easy can you make for somebody to get it admitted, right? The
yeah,
Aadhaar number that we spoke about, a very similar thing. And you have a
yes,
SSN, and then everything else, you just authorize your consent, and that information that they require for registration is done. You have an insurance, you just give
yeah.
a consent, that is done.
In fact, it could happen
Even
even
before you
before
come in,
you,
just
if
the
you have to
intent
go,
of it,
even
right?
before
It
you,
shows in the
yeah,
hospital, and then this is a doctor
yeah,
you're going in. All
yeah,
these things are done, so your waiting
yeah,
time is cut down. There's a nurse or
yeah,
virtual assistant who's going to assist you throughout the process until you get your kind of room and what kind of facilities that you want in that room, right? Premium and deluxe, or
correct,
you want an
correct,
AC, you want a sea view. I mean, today we have hospitals, where you have even much more better
like
facilities than a
hotels.
five-star hotel, right?
So,
And the care,
yes,
what kind of food that is
yeah,
going to be served based on the condition that you have, and then the balanced diet and all that experience till your surgery, what
yeah,
needs to be done, who's the doctor going to
yeah,
come in, preparing you for that, right? And then post preparation, post the surgery or the treatment, what are the things that one needs to follow up, ensuring that they're getting enough reminders of
yeah.
medicine reminders, refill reminders, and the post discharge, all the process that is required to hand off the insurance part, copay part, right?
Correct. So on the insurance part, actually today, you initiate insurance
The cashless,
claim only. Yeah, no, but that's only happens to when you want to
yeah, yeah,
check
yeah,
out, right? And then they
everything, yeah,
calculate 10,000 metrics
yeah,
and all of that, right? But it could happen as
yeah,
you are
yes,
receiving treatment, right? And that could help your outpatient. I mean, your
experience.
outpatient processes need not be so complex, right? It should be like, okay, I want to go. Somebody comes and or you get an assistant to basically tell you that you're doing fine, you have to do ABC, and then you get some documents, or you get access to data on an app or something, and then you just
Go home, and
go
then
home,
you get
right?
what and all things you need to follow, so that you don't relapse or do a readmission, so that the
Correct.
insurance company
Yeah.
also
Yeah.
understands what kind of a premium that I need to give, because if somebody is following the proper procedure and things, there's a chance of this person
Correct.
getting sick again is lesser. So all these
Yeah.
things will
Yes.
matter,
Yes.
and then it only creates a better experience for patients. And if it happens in scale, right, and then we can also think about how, uh, let's say for example, I'm giving my data about my personal health to these organizations, and these organizations use them for various things. Can they make it more affordable for me, right? If now whatever we are speaking is something which is ultra luxury, maybe for
Yeah.
some people, not for everyone, but
Yeah.
can
Correct.
it also help, because this data engineering coming into picture, AI coming into picture, and interoperability coming into
Y-
picture, can it make
Yeah.
more
In fact,
easy and
in
affordable?
fact today, in the US, you need to work for 8 years to become a fully qualified doctor. In India,
Yeah.
it's about 5 years plus getting admission to a right college is
And
also
just the
very
MBBS is
hard,
not
right?
enough. Today you
So
need
what?
specialization, MD,
Yeah.
DM, and all that.
Yeah, correct. So what this data can do is, I mean, it could make doctors learn better and maybe even faster, because I mean, I know saying faster sounds good now, but then if you think of a doctor who studied only for 2 years and then they're operating on you, maybe
Yeah.
you wouldn't be feel so conscious as well. But in a society where we respect data driven insights and decisions more, this could become a reality where more people would opt to become doctors, because it is less taxing on a time boundary,
It's all about
space, and then
specialization. You're good
people
at
who,
something, you just
yeah,
need 2 years of course for
yeah,
this, but you can then add on
correct.
courses over a period of time if you want to give more
Yeah, but
specialization.
yeah, and why can you do that? Because you have access to this kind of information, insights, and
And
all of that,
automations,
right?
maybe a robotic surgery, and then you have
Yeah,
insights and previous history of learning, knowledge from different
Correct.
doctors, and not one person
Correct.
call, usually
Correct.
taken by many, and you can transfer this data to
Yeah.
someone and get the approval from them and
Correct.
then operate on this.
Correct. Yeah. So then maybe junior doctors could be given more
Yes, we
responsibility,
spoke about that in the
right?
last
And then they could share it.
uh,
Yeah.
podcast about
Yeah.
how we can retain knowledge, and yeah, how junior doctors can
Yeah.
learn more
Correct.
and do more.
Yeah. That's yeah. And maybe it could also improve the syllabus for a lot of healthcare courses, right? Maybe it could be like, of course, today a lot of the stuff is digital, right? But textbooks can get outdated quite fast, and using real life information and data, like how many more people are actually sort of, for example, cancer has been on a rise, right, over the last 50, 60, 70 years, right? So, in giving that information to people wanting to go into healthcare could make them more interested in joining, the race against that
Yeah,
disease, right? So you don't have to wait 20 years for there to be a lot of oncologists. Maybe in the next 5 years itself, the number of oncologists could increase.
right.
Things like that.
Interesting. What other
Yeah.
things, I believe, did we miss out something? I think there's something about yeah. What are the, so we spoke about what other opportunities we have. We spoke about, I think in the last podcast also we spoke about the clinical trials and the study and drug discovery and all that part. Today we spoke about more from the patient care and
I
citizen
think
sharing.
one thing that we did not speak about is on medtech, how the world is moving towards. I mean, when you talk
Yeah.
about 2050, how can I not talk about implantables
Yes.
and things like that? So for example, Neuralink and all
Yeah.
these other. I mean, there are a lot of
Maybe it analyzes in the brain that, okay, this is the
competition.
signal that is coming in,
Yeah.
and
So
because of this signal,
yeah.
maybe it's acidity, it's not
Yeah. So this, when we go back to our three V's, will increase a lot
yes,
of these three V's, right? So data engineering is now seems even more
yes,
important, because the volume of, so once you start going into monitoring and implanting hardware
yeah,
into your body, it will record on the
yes,
millisecond level, right?
start
And
transmitting data
multiple different
also, and then
metrics.
you may have, today we
Yeah.
are talking 6G, maybe 10G, 20G, and then you may
Yeah,
you
yeah,
may
yeah.
be
Right.
whatever speed you may be able to give this data as a connectivity.
Correct. No, and you would need, I mean, if you don't have the right data engineering pipeline or strategy, right, you will lose out in getting the right information from the data,
How
right?
faster you can process data
And
itself is now, and how you can collect this data and do a faster processing will be the more uh,
correct, correct.
thing. No.
Correct. Yeah. So that, I think that is something in 2050 where actually, once you give consent, there may be a bunch of hardware already inside your different body parts that is sending information to the right people, right? And for that, data engineering and AI and tech will have to improve a lot, and people have to invest in it. So only if people invest in it, it will improve, right? Like the whole GPU race over the last 2 years, it's become 10x, and the GPUs have improved 10x also because people are
They
investing in
just,
it. There is a demand, right?
what I
So
understand is that they are saying that let's max out on the already available algorithms that we have. Let's invest in the GPU. We
yeah,
will optimize
yeah,
the algorithms and the MLs and whatever we have written. But let's say now, if the compute power is the problem, let's invest in the compute power and maximize that,
yeah,
and see how much
yeah,
more can we achieve, how better results can we achieve.
yes,
That is where
yes.
we are going now.
Yeah, very, very
Yes.
exciting days. Maybe, you never know. We may live till 150, 200 at this rate.
And hopefully do
Yeah.
good for the society, not because what,
Yeah, yeah. I mean, live healthily, not just live like, like a vegetable, but live healthily and, yeah,
contribute to
contribute
the
to
society.
society. Yeah.
Very interesting discussion today, Atul. Anything that you want to put out on the closing comments? I think we can close.
No, no, for me, it was a very interesting discussion. I'm just excited at thinking, how it's gonna pan out, right? And I mean, 2050, I'll be quite old by then, but then it's gonna be. I mean, you never know. I may be still young
People are aging back.
because I may live
Yeah,
till
people are
200,
aging
right?
back. Maybe you can come with some sort of a pill.
People are
Just
aging
have the pill and
backwards, right?
pop in. You don't
Yeah,
have to do
yeah,
anything.
yeah. Like, there's a project called Project Blueprint where there's a person, is an
Yeah,
ex
yeah, yeah.
billionaire, owner of
Who's become now
Venmo.
he's a
Yeah, so
40-year
he,
old guy now, become like his biological age he has
yeah, his
hacked and
vitals,
made biohacking and done
yeah,
18 years now.
exactly. So his biological age is around 18, almost 18, 19 on for most of his
Yeah,
organs, right? So I mean, that could not have been done without data engineering, right? Can you imagine the amount of data just of one person and
yes.
his day, right? And scale that to 8 billion, it's crazy,
And a
right?
lot of influencers
It's
are using this biohacking and promoting. So one of the centers in Chennai, they are analyzing your skin, they are analyzing your VO max 2, they are analyzing how much oxygen you are
oh,
getting in, and there are various parameters, and they're going to say that okay, your posture correction should be this way and all that. And this is all about
yeah,
personal healthcare, and this is not possible if they don't collect data, right? They have to collect this data,
correct,
and then
correct.
if imagine this is for one person, now we do it for the whole nation. Better policies can be
Yeah,
made, better health decisions can be made, better budgeting can be made if we have
yeah.
access, if the government has right intentions and intent to get data.
In fact, even things that we would not have thought about would be possible. Like maybe furniture designers
Furniture,
would be designing furniture in a different way, right? It's so random, but you won't think about that in healthcare, but it's
right?
definitely possible,
And
right?
personalized, everything personalized, because
Yeah,
people have the
yeah,
money and
yeah,
they want to spend on something that is for them, that is going to add value to them,
yeah.
quality
To
of life,
improve
of
quality of
course.
life, yes. Yeah,
So, well, on that note, I think it was a good discussion. I think we would like
yeah.
to end the conversation there for today, and hopefully we'll come back with why? Hopefully, we'll definitely come back
No,
with
we
a new
will. Yeah,
episode,
definitely.
maybe
There's
with
no
a
more
new
hoping now.
topic
Now we,
and interesting trends.
yes.
Thank you so much, and keep watching Pace Wisdom channel, YouTube, LinkedIn, and wherever you're seeing this content. And like, comment, and subscribe. Thank you.